Hi, I'm Jay McCullum with Core Balance Therapy, back for our usual Friday video, and today I want to talk a little bit about why sometimes pain is persistent. And what we really understand is that it's hard to explain persistent pain just on the basis of structure, because there's just a bad link between how things look on things like MRIs and CT scans and x-rays and how much people hurt. So we really need to dig a little deeper, and this is a model that I like to use to explain to patients why sometimes pain stays even after tissue is healed. And so the peaks here, this two-peak system, is designed to sort of represent the tissue tolerance. So if you look here, as I apply more load to the tissue at some point in time in a normal nervous system, I should start to experience pain, and I should start to have that pain before I reach the point of tissue damage. I'd like to have this little bit of a buffer right here between experiencing pain and actually damaging myself, so that can warn me that perhaps I should stop this activity. When I have an injury, obviously there's a reduction in my tissue tolerance for a period of time, and so my threshold for pain will drop. And then as my tissue heals, a lot of times the pain threshold doesn't move up with it. And you end up in a state where the tissue's well healed. My tissue tolerance is pretty close to where it was even after the injury, but the amount of load that I get before I get pain is much less, and my buffer now is really too big. So I'm getting warned about tissue damage way before I get to the point of doing any tissue damage. And I can even get the second line, which is really an unpleasant line, which we call the flare line, where if I load the tissue past the point of the flare line, I'll regret it for days. And so what we're looking at for many of our patients who have pain that has lasted for a long time is less about how can I make the tissue better, because the tissue is often well healed, or it's as good as it's going to get. And I'm much more interested in how can I change this line? How can I start to get the nervous system to become less sensitive so that it's not working so hard to overprotect me? And we do that largely by trying to kind of nudge the load up into the pain level without setting off flares, and gradually sort of get the nervous system used to this loading pattern, so it's less threatened by it, and people can do a bit more with less pain. So that's a really short discussion of part of why pain can be persistent. We'll post some more videos over time about that, but in the meantime, if you have any questions or you want to learn more, please feel free to give us a call. Thanks for listening.